So good afternoon, students.
Good afternoon, sir.
Okay, so I can see, still not all the students have joined, but I think we can start the class. So students, last time we talked about hypersensitivity type 2 reaction, okay, and we will continue with type 2 reaction today. And we have 2 hours today. So my target would be to complete type 2, type 3, and in the next class maybe we'll complete the type 4. Okay, so we'll complete with hypersensitivity today, and tomorrow again we have a class. So I'll try to complete autoimmunity in that. Okay, so this way your most of the topics, the major topics will be complete. Okay, and then we'll have small topics like what are vaccines, what are the different types of vaccines, right? And then most of the topics will be covered through your presentations, right? So just give me 1 minute. We'll start with the class. Let me upload the slides.
Sir, you are not audible.
Yeah, just hold on. Okay, so students, like this was the last thing that we did in type 2 hypersensitivity. So this is your, complement mediated lysis of the blood which has been transfused. So if the wrong blood is transfused, you can see our immune system sees these antigens, right? And when it recognizes as foreign, it, you know, generates antibodies, which leads to activation of the complement system, and then ultimately it leads to formation of MAC, and the RBC gets lysed, right? So we have discussed this, so I'm not going to discuss this again, but let's move ahead. So another type of hemolytic anemia is, drug induced hemolytic anemia. So now students, what happens, you know, some of the people may be, uh, you know, allergic to some antibiotics. Okay. So now certain antibiotics can adsorb non-specifically to proteins on RBC membranes, right? So these antibiotics can bind on the RBC membrane, right? Now, when antibiotics and RBC, they uh, form a complex, so it forms a complex which is similar to the hapten carrier complex, and we have already discussed this, right? So, a lot of antibiotics like penicillin, cephalosporin, streptomycin, dapsone, leverdapsone, so many, drugs, right? So they can induce uh, hemolytic anemia, or they can induce type 2 hypersensitivity reaction. The mechanism remains the same जो हमने पिछली बार देखा था. Okay, so in some patients, what happens, these drug protein complex induce formation of antibodies. Okay, now these antibodies then bind and adsorb drug on the RBC, right? And when this happens, it induces a complement mediated lysis, and thus there will be anemia. Okay, so when the drug is withdrawn, hemolytic anemia disappears. So you can see here, this is your drug, right? So no reaction to the drug. Okay, so if you take drug, immune response will not generate, right? Now this is your own RBC, right? Again, our system will not generate antibodies against us, right? But in some people, this drug will bind to RBC like this, right? And when this happens, okay, antibodies are generated against this drug. Okay. Now, when antigen antibody binding takes place on the surface of a cell, then it leads to activation of the complement system. Okay. And because of that, this cell will lyse, right? And because of which anemia will happen, right? Clear? What will be the symptoms? One of the symptom will be dark urine, right? We discussed this last time also, because the RBC has lysed. So all the internal components like the heme of hemoglobin will come out, and that will lead to dark urine, right? There will be anemia, right? RBC खत्म हो रहे हैं इसलिए there will be fatigue, right? RBC खत्म हो रहा है इसलिए there will be pale skin color, okay? There will be rapid heartbeat, shortness of breath, and jaundice, right? Skin color will be yellowish. The person looks yellowish, okay? Now, if we talk about one of the antibiotics, penicillin, it is very common antibiotic. It is notable in that it can induce all four types of hypersensitivity, right? So in when we talked about type 1, we saw how IgE can lead to type 1 reaction. Type 2 reaction again, this penicillin can go and bind to the RBC and can cause hemolytic anemia. right? Penicillin can also lead to type 3 and type 4 hypersensitivity reaction. So, penicillin, yes, it is very effective, very helpful, but in some individuals, it can also lead to a kind of reaction. Okay. Now, another disease or another reaction associated with type 2 hypersensitivity is hemolytic disease of the newborn. Okay. Now, again, you can see this is hemolytic. So, basically, it will also target the RBCs, right? Now, hemolytic disease, but this disease is of the newborn. Okay, so the fetus is in danger in this case, right? So hemolytic disease of newborn develop when mother's immunoglobulin G, we are talking about maternal IgG antibodies, which are specific for fetal blood group antigens, they cross placenta and destroy the fetal RBC. So just try to understand this sentence. So we are talking about hemolytic disease of newborn. Okay. When it happens? When mother's immunoglobulin G antibodies, okay, mother ki immuno IgG, okay, which is specific for fetal blood group antigen, right? Mother ki antibody और एंटीजन कहाँ है on the fetal blood group, right? And IgG can cross the placenta, right? So mother की antibodies will cross the placenta, right, and reach the antigens which are present on fetal blood. Okay, and when this antigen antibody reaction will take place, it will destroy the fetal RBC, right? You understand? Clear? Mother is having the antibodies. Where is the antigen? It is on the blood of the fetus. Okay, जब हमने antibodies की बात की थी, so I said antibodies, some of the types can cross the placenta. So mother की antibody will cross the placenta, reach the RBC of the fetus, and it will start destroying the blood cells of the fetus. Okay, so the consequences of such reaction can be minor, serious, or can be lethal, right? The newborn can die. So now let's see how this happens, why this happens. Okay, now severe hemolytic disease of newborn is called erythroblastosis fetalis. So students, have you heard this name earlier? Have you heard the name of this disease earlier? Anyone?
No, sir.
No? Okay. So students, what happens? This disease happens when an Rh positive fetus expresses Rh antigen on its blood cells that the Rh negative mother does not express. So it happens in a condition where the mother is Rh negative. Okay, like we say, we say AB positive, AB negative. So the positive and negative is about the Rh, right? So the mother is Rh negative, right? So mother's system has not seen Rh factor or the Rh antigen. Okay, but now the baby is Rh positive. Okay, so now there is a new antigen in the female's body, right? Clear? So the immune system of the mother sees that antigen Rh, which is present on the fetus, right, as foreign. And immune system का तो काम ही यही है that when it sees a foreign object, it generates an immune response, right? So mother will develop antibodies to destroy the fetal RBC. Right? This concept is clear?
Yes, sir.
Okay. So you know what happens during pregnancy? These fetal RBCs are separated from mother's circulation by a layer of cells in the placenta, which are called trophoblast. Okay. So you know the trophoblast is separating the RBC of the mother and the baby. Okay. So during her first pregnancy with an Rh positive fetus, an Rh negative woman is usually not exposed to enough fetal RBC. So, you know, when for the first time a Rh negative female gets pregnant, right? So, you know, nature has created that system that there is no exchange of blood of the child and the mother, okay? Because it is separated by a trophoblast, right? So, in first pregnancy, there is no problem, okay? Nothing will happen, right? But students, at the time of delivery, okay, separation of placenta from the uterine walls allow large amount of fetal umbilical cord blood to enter mother circulation. So you can understand when delivery happens, right, lot of fetal blood can get into mother's circulation, right? So now what happens? So just try to, imagine when this delivery happens, okay, when the baby is being taken out, right? So at that time, some of the RBC of the fetus from the umbilical cord, right, it may enter into the mother's circulation, right? So now what happened? The Rh positive blood, right? The Rh positive RBCs have entered into the mother's circulation who is Rh negative, right? So these fetal RBCs activate Rh specific B cells, right? Because now, it's a new antigen, right? It's a foreign antigen because the mother's system has not seen Rh factor, right? So it will activate the B cells, resulting in production of Rh specific plasma cells and the memory cells, right? तो अब क्या होगा? B cells activate होंगे, they will become plasma cells and they will start secreting antibodies, okay? And they will go and bind to all the RBC which is there in the mother circulation, right? And they will also generate memory B cell, right? So जब भी immune system activate होता है, so it also generates memory, right? So that when the second time same antigen enters, our immune system produces a very strong robust immune response, right? So अब क्या होगा? अभी just after delivery, right, जो भी mothers circulation में RBC गए हैं baby के, right, so that will activate the plasma cells, the B cells. B cell will secrete antibodies. Those antibodies will go and bind to those RBC and clear it from the mother's circulation, right? तो जो बच्चे के जो RBC आए थे वो क्लियर हो गए, right? But memory cells will always remain, right? Memory cells का तो काम ही यही होता है that even after 10 years, 20 years, when the same antigen comes, these memory B cells get activated and they will start producing antibodies, right? So because of this memory cells, okay, there is a threat to any subsequent pregnancy with a Rh positive fetus. So if the same female gets pregnant for the second time with Rh positive, you know, baby, then the baby is in danger because now the mother have the memory cell, mother have the antibodies, and those memory cells will also start producing antibodies, and all those antibodies will cross the placenta, reach to the fetal RBC and they will start destroying the fetal RBC, right? So activation of these memory cells in subsequent pregnancy result in formation of immunoglobulin G anti-RH antibodies, right? So antibodies against the RH antigen, okay, which can cross placenta and damage fetal RBC. When this happens, there can be mild to severe anemia, okay, in the fetus, and sometimes it can be fatal, okay. Now there is another problem is that conversion of hemoglobin to bilirubin, right? So जब आरबीसी का ब्रेकडाउन होगा तो हीमोग्लोबिन बाहर आएगा और उसका ब्रेकडाउन हो जाएगा इनटू बिलिरुबिन, राइट? So that presents an additional threat to the newborn, right? Because the lipid soluble bilirubin may accumulate in the brain and can cause brain damage. Okay, तो एक तो brain damage होगा, ऊपर से anemia हो जाएगा, right? So that can be fatal to the fetus. So अभी मैंने जो बताया, just let's try to understand this with the help of this figure. Okay, so now the father is RH positive, mother is RH negative. Okay, now you know when this female gets pregnant, so you can see the female is negative, but the fetus inside is positive. Okay, but at this time, you know, this it is basically protected from mother's antibody, okay, because you know at this time mother is not producing any antibody against this antigen, okay. But as I said, at the time of delivery some of the fetal cells will get into mother's circulation, right? And when this happens, our her immune system will get activated, it will produce antibodies which will take away all these cells or destroy these cells, okay. Now what happens, the mother circulation have antibodies, okay, against RH antigen, okay. Now what happens, this female again becomes pregnant, and now these antibodies, right, they can cross the placenta and reach the baby and can start destroying the fetal RBC, right? So this is called as erythroblastosis fetalis. So I think with this picture, you know, it would be clear to all of you. Okay. Again, it's the same thing. So in initial pregnancy, you know, the cells are separated, so no problem. But at the time of delivery, you know, some of the fetal RBC gets into the mother's circulation, and then antibodies are generated, you know, and during second pregnancy, those antibodies, they get into the fetus and start destroying its RBC, right? And you know the child will be suffering from erythroblastosis fetalis, in which there will be anemia, kind of jaundice because of high bilirubin, right? And that can be lead to possible death. Okay.
Excuse me, sir.
Yes.
Can you please repeat the last slide? Actually, my network was entirely broken.
Okay.
So I couldn't hear
I
anything.
think I would like some student to explain this with the help of this. Anyone want to explain this? I'll just show you the image. So who want to explain this image? Yes, Manaswini. Okay, now let me just share the screen.
Okay, sir.
Yes, Manaswini, you can explain this.
Okay, sir, am I audible?
Yes, you're audible.
Okay, so in this case, there is an Rh positive father and an Rh negative mother. So during the first pregnancy, let's say the Rh negative mother is pregnant with an Rh positive baby, then during pregnancy there isn't too much of an issue. But then once there is delivery, what happens is the umbilical cord blood of the fetus will mix with the mother's, and the mother's immune system will detect the Rh positive RBCs as foreign. So because of that, it will deploy B cells, which will turn into plasma cells and memory cells, and the plasma cells will destroy the Rh positive blood cells, and after that the plasma cells are gone, but the memory cells remain and they remember the Rh positive blood cells. And then let's say months later, if there's another pregnancy with another Rh positive baby, then it poses a threat because the memory cells will remember the Rh positive RBCs as a threat and as a foreign antigen, and because of that they will attack the blood, and that will they'll destroy the RBCs. So that will result in anemia, and in some cases it can also result in brain damage, because the free hemoglobin will be converted to bilirubin, and that will accumulate in the brain.
Yes. So, Yuvraj, is it clear?
Yes, sir.
Okay. Okay. So it's the same thing, same diagram shown in a different way, right? But ultimately, because the mother's antibody are destroying the fetal RBC, there can be jaundice, there will be anemia, and it can lead to death of the child, right? So this is your type 2 hypersensitivity reaction. Okay, but the good thing is, we can prevent such issues, right? So for that, again, you need to have a good understanding of the immune system, right? And, with the help of monoclonal antibodies, you can prevent this problem. Okay, now let's see how we can prevent it. Now, disease to the newborn caused by Rh incompatibility in subsequent pregnancy can almost entirely be prevented. Okay, so we can prevent this problem. How? By administrating antibodies against Rh antigen, okay, to the mother within 24 to 48 hours of the delivery, of the first delivery, right? So what you need to do is, you know जैसे ही बच्चे की डिलीवरी हो, right, you give anti-RH antibodies, right? You give an injection of anti-RH antibodies. So उससे क्या होगा? Those anti-RH antibodies, right, they will go and bind to the uh, RBC blood, okay, before, and they will remove it from the mother's circulation before the immune system gets activated, right? So वो होता है ना कि किसी को कोई शैतानी करनी है और वो घर पे अकेला है, तो मम्मी पापा के आने से पहले पहले कर लो, ठीक है? सो इसमें भी वही केस है, मदर का इम्यून सिस्टम एक्टिवेट हो उससे पहले ही वो RH पॉजिटिव ब्लड्स को हटा दो. Okay, now these anti-RH antibodies are called ROGAM. Okay, and they bind to any fetal RBC that enters the mother circulation at the time of delivery. Okay, and that leads to their clearance before B cell activation and ensuing memory cells production takes place. Okay, because see, problem is the memory cell, right? So B cell को एक्टिवेट होने से पहले पहले फीटस के सारे आरबीसी को डिस्ट्रॉय कर दो, उनको हटा दो. ओके, सो दिस इज अ स्ट्रैटेजी विच इज यूज्ड. सो जैसे ही मदर की डिलीवरी हो उसी टाइम रोगैम का इंजेक्शन दे दो, so that all the fetal RBC are, taken away from the circulation before the B cells of the mother get activated. Okay, you can see this picture of rogam. Okay, so you can see it's human. So this is antibody against human. Okay, and you can see the dose. You can just see this, right? Okay, so this is what I was saying, that if we add uh, rogam second pregnancy mein, okay, uh, yes, so this is the mechanism which I've already discussed. Now if we give rogam, okay, so B cells will not get activated, right? Because the rogam will bind to the fetal RBC. Okay, so in this case, your B cells will not get activated, and this prevents B cell activation and memory cell formation. Okay, clear?
Yes, sir.
Okay, any questions on this? Students, any question? Is everything clear?
Yes.
Okay. Okay, so with this your type 2 hypersensitivity is over. Okay. So we'll have attendance break, and after that we'll start with type 3 hypersensitivity. Okay. So students, I have also sent you a video link. Okay. So maybe in your spare time, you can just go and see this video. I think this is a 12-minute video on erythroblastosis fetalis. Okay. So whenever you get time, you can see this video. Okay. Okay. So let's have your attendance. Adish,
Yes, sir. Yes, sir.
Adish, you are not visible.
Visible, sir.
Present. Present, sir.
Yes, Ayushi. Ayushi,
Yes, sir.
Ayushi, you are also not visible. Yes, Sam. देवांशी, इशिता, जानवी,
Present, sir.
मनस्वनी,
Present, sir.
क्षितिज, नम्रता,
Present, sir.
नंदिनी,
Present, sir.
नेहल, नेहल, रूपल, रूपल, साहिबा,
Present, sir.
संजना,
Present, sir.
शक्ति,
Present, sir.
शिवानी, तन्वी,
Present, sir. Present, sir.
त्रिदेव, त्रिदेव,
Present, sir.
वंशिका,
Present, sir.
विवेक, विवेक, युक्ता,
Present, sir.
युवराज,
Present, sir.
so I think only Kshitij is absent, right?
Yes, sir.
Okay, okay. So students, we have completed type 2 hypersensitivity reaction. So now we will start with type 3 hypersensitivity reaction. Okay, so students, if you remember when we talked about, the gel and Coombs classification, I said that type 3 reaction is, it is initiated because of the immune complexes. And you know what are immune complexes? These are complex of antigen and antibody, right? So generally what happen in our system, बहुत सारे immune complexes बनते हैं, right? Which is required, एक antigen आया, antibody उस पे जाके bind कर जाएगी, right? So when this happens, the complexing of antigen with antibody, it leads to the clearance of antigen by the phagocytic cells, right? So जब हमारी body में एक immune complex बनता है, right? Then these phagocytic cells come, and through the receptor binding they will take up this complex and eat it, right? But in some cases, large amount of immune complexes are formed, and that can lead to tissue damaging type 3 hypersensitivity reaction, right? So in some cases, there can be type 3 hypersensitivity reaction when there are large amount of immune complexes. Okay. Now, जो इसका आउटकम होगा इस रिएक्शन का, So the magnitude of this reaction depends on the quantity, okay, how much of immune complex is formed, okay, so that is quantity, okay, as well as the distribution within the body, right? So now the thing is, हमारी बॉडी के अंदर एंटीजन आया, ओके, उस पे एंटीबॉडी ने बाइंड किया, ओके, जनरली क्या होगा, इस कॉम्प्लेक्स को फैगोसिटिक सेल आके खा जाएगा, ओके, बट इन सम केसेस एंटीजन एंटीबॉडी कॉम्प्लेक्सेस आर मेड इन लार्ज नंबर्स, ओके, एंड दैट कैन लीड टू टाइप 3 हाइपरसेंसिटिविटी रिएक्शन. और उस रिएक्शन का इफेक्ट क्या होगा, इट इज डिपेंडेंट ऑन द नंबर ऑफ दीज इम्यून कॉम्प्लेक्सेस एंड their distribution in the body, right? कि बॉडी के किस पार्ट में ये इम्यून कॉम्प्लेक्सेस बन रहे हैं या डिपॉजिट हो रहे हैं, okay? So when these complexes are deposited in tissues very near the site of antigen entry, then a localized reaction develops, okay? Now just imagine, skin, on the skin your antigen has entered and this immune complex is formed. So if this reaction occurs there, then a localized reaction is developed, reaction around the point of entry, okay? But when these complexes are formed in the blood, the reaction can develop wherever these complexes are deposited, okay? So in this case, the first case, there is a point from where the antigen will enter, right? And the reaction will start there, and there will be a localized reaction, right? But if the same thing happens in the blood, then what happens? Blood के अंदर तो वो circulation है, and blood is going every part of the body, right? So those immune complexes can go and settle down at any place, and wherever they will go and settle down, they will cause a reaction at that site, okay? Clear? Clear?
Yes, sir.
Okay, okay. Now, as I said, these immune complexes, they can go and bind at any particular point, okay? So, but basically they are frequently observed on the blood vessel wall, okay? Right? They can get deposited in the synovial membrane of joints, okay? They can get deposited on the glomerular basement membrane of kidneys, or they can get deposited on the choroid plexus of the brain, right? So ये जहाँ पे भी settle होंगे, right? Suppose they get settled in the synovial membrane of the joints, so they will create joint pain, they will cause arthritis, inflammation of the joints, okay? If they get settled in the glomerular basement membrane of kidney, they will create kidney issues, right? They will cause glomerulonephritis, okay? Similarly, if they deposited on the choroid plexus of the brain, then they will cause inflammation in the brain, right? So deposition of these complex initiate a reaction, okay, that leads to recruitment of neutrophils to that site, okay? Obviously you know this, सबसे पहले neutrophils आते हैं जहां भी लड़ाई चल रही होती है एंटीजन एंटीबॉडी की, right? So सबसे पहले neutrophils will come to eat them, right? So wherever these immune complex gets deposited, right, there will be recruitment of neutrophils to the site.
So why only the neutrophils come?
Yes?
So why is it necessary that neutrophils comes at there? Yes.
Yuvraj, it's not clear what you are saying. Any other student can tell what is he saying?
So he's asking why only neutrophils come to the site.
Okay, so it's not that only neutrophils come, but neutrophils are the first one to come to the site. Okay, जैसे अगर कहीं पे लड़ाई होती है तो सबसे पहले पुलिस आएगी, लोकल पुलिस, ठीक है. बट इफ द सिचुएशन इज नॉट getting under control, police will ask the more police to join, right? Then there may be need for specialized police, right? So it all depends. But यहाँ पे क्या होगा, जब भी कोई इन्फेक्शन होता है किसी भी पॉइंट पे, सबसे पहले न्यूट्रोफिल्स जाते हैं वहाँ पे. ओके, so when these neutrophils they reach that site, okay, so neutrophils, they are granulytic cells, right? So in this case the tissues, they get injured as a consequence of granular release from the neutrophils, right? So अब क्या होता है, neutrophils वहां पहुंच जाते हैं, neutrophils try to capture these antigen antibody complexes, और उसको कैच करने के चक्कर में they release lot of granular content, and that granular content will cause tissue damage in that area. Okay, so this is the whole idea of type 3 hypersensitivity reaction, right? So you can see here in this, the culprits are your antigen, antibody, and the neutrophils, right? So अभी हम इसको और डिटेल में देख लेते हैं. So type 3 hypersensitivity reaction develop when immune complex activate the complement system. So again, how complement system work. Okay, now जब complement system activate होता है, then you know about these components, the C3A, C4A and C5A. So these are the smaller complement proteins, right? So these are the complement split products and are anaphylatoxins. Okay, and they cause localized mast cell degranulation and consequent increase in local vascular permeability, right? So these complement protein are also chemotactic factors, right? तो जब ये कॉम्प्लीमेंट सिस्टम एक्टिवेट होता है और ये जो छोटे छोटे जो उसके पार्ट्स बनते हैं, दे आर ऑल्सो chemotactic factor. What do you mean by chemotactic factor? It means they are chemo attractant, right? तो न्यूट्रोफिल्स को जहां दिखता है कि ये C3A बन गए हैं या C4A, तो न्यूट्रोफिल्स उनकी तरफ जाने लगता है, right? So these complement proteins, they act as a signal for the neutrophils, right? So ये C3A signal देता है that some problem has occurred, there is a fight going on between antigen antibody, so please come. So जैसे ये signal मिलता है, neutrophils start going to the site. Okay, now obviously the lot of neutrophils can accumulate, right? So which can accumulate in large numbers at the site of immune complex deposition. So जहां भी immune complex deposit हुए, right? So they were in the circulation, now they have got deposited, right? Now a lot of neutrophils are coming to this site, right? अब क्या होगा, वो एक के बाद एक के बाद एक के बाद बहुत सारे neutrophils आना शुरू हो जाएंगे. And you can just imagine, I don't know if you have seen, जब हम देखते हैं कि पुलिस चेजेस, अगर तुमने यूएस में पुलिस चेजेस देखा है तो एक कार को पकड़ने के लिए there will be 20, 30, 40 police vehicles, right? And at a point when they get hold of the culprit, there will be so many cars around that culprit, right? So similarly यहाँ पे इन immune complexes को capture करने के लिए lot of neutrophils will come at a particular site. Okay, so students, I'll just stop here. आगे की story हम next class में शुरू करते हैं after 5 minutes. So by the time you absorb all this, and then we'll discuss after the class. So if in the meantime, if you have any question, you can ask. Okay, students, so when should we have your midterm? I think we can have two topics for your midterm exam. Uh, Complement system and antigen processing and presentation. Okay, so only two topics. So I think so in the week of 25th to 29, any date between this. So we can have it on 26th or 27th or 28th. Is it okay?
Yes, sir.
Okay. So tentatively we'll have it around 26 to 28. In these 3 days we can have it, okay?
Okay, sir.
And students, also be ready for your presentations because we are going to start with the presentation in the next week, and at least 3 presentations per day. Okay, so you can accordingly divide your time.
So, what will be the syllabus for the internal exam?
Complement system and antigen processing and presentation.
Okay, sir.
Okay.
Okay, sir.
Okay,
Yes,
sir.
sir.
Okay, so students, so I'm ending the class now and we'll meet after 5-7 minutes. Okay.
Thank you, sir.
Okay.